Good afternoon, everyone. Welcome to today's COVID-19 update in Alberta. With us is Dr. Dina Hinshaw, Alberta's Chief Medical Officer of Health. Today we also have Andre Kobold, Deputy Minister of Alberta Education, who will also be available to answer questions. Dr. Hinshaw will first provide some brief remarks, and then we will open the floor for questions.
Thank you, Shireen, and good afternoon, everyone. Before I get to today's COVID update, I need to update information I shared last week about Bright Horizons daycare and out-of-school care. At that time, our numbers showed that the facility had 6 active cases over several weeks. However, this was incorrect. 5 cases have been linked to Bright Horizons, 2 staff and 2 children in the toddler room, and 1 child in the out-of-school room who had a source of exposure outside the facility. I commend Bright Horizons for being more than cooperative in providing information and working with the team at Alberta Health Services, and I apologize for the incorrect information that was previously reported. Turning to today's update, I will share the data over the last 72 hours. For the 24 hours on Friday, August 28th, we identified 133 new cases, and the provincial lab completed 10,220 tests. For Saturday, August 19th, we identified 184 new cases. On that day, 11,205 tests were completed. Finally, over the last 24 hours, we detected 109 new cases, and 12,244 tests were completed. Sadly, I must report 2 more deaths over the weekend, a male in his 80s in the Edmonton zone and a male in his 90s in the North zone. My sympathies go out to all who lost loved ones this past weekend, whether to COVID-19 or any other cause. Today, there are 1,370 active cases in the province. 44 people are in the hospital, including 8 in intensive care. In all, 12,293 Albertans have recovered. I also must report several outbreaks of note in the province. There is a new outbreak I am reporting today linked to Calgary's Kadana-Meherut Ethiopian Orthodox Tewahedo Church, with 57 confirmed cases of COVID-19. This outbreak was just identified in the last several days, and public health teams are still working to trace contacts and understand the full scope of this outbreak. As a precaution, as we did for previous faith-gathering outbreaks, we are asking anyone who attended this church in the last 2 weeks to get tested, stay home if they have any symptoms, and wait to hear from public health. Children who attended this church in the last 2 weeks should not go to school this week as a precaution. While we don't know yet if all who attended this church are close contacts, the case numbers we have seen to date are raising concerns that there could be more cases, and we want those in this community to have this information. As a precaution, we are making this request regarding children staying home from school to give our public health teams time to do the investigation and provide clarity to the congregation. It is critical, as always, that members of this church be supported and not targeted or stigmatized. An outbreak can occur anywhere, and those involved need our compassion in this difficult time. At workplaces, we were informed of an outbreak at an Edmonton Walmart supercenter with 8 active cases among staff. It is not clear at this time if these staff were exposed at work or if there is a common exposure outside of the workplace. The Lilydale chicken plant in Calgary has 24 cases, 3 of which are recovered, and the Cargill Case Ready plant has 1 active case and 6 recovered cases. The Harmony Meat plant has 66 active cases and 3 recovered cases. I want to emphasize that management and staff involved in all of the outbreaks are working closely with public health to prevent the spread. I have said this previously, but it is worth repeating today. Our goal is to keep daily case numbers low, avoid outbreaks, and manage them carefully when they occur. When I say collectively, I mean all of us, you, me, health practitioners, families, employers and workers, retail managers and associates. Through our actions, each one of us has the ability to either pass along the virus or stop its spread. Our case numbers over the past 3 days raise concerns, and we will be looking closely at the new numbers to determine if any additional steps need to be taken. School is starting this week in many places across the province, and the success of schools reopening depends on all of us. As teachers welcome students back to classrooms today or prepare for the return of students this week or next, I would like to clarify Order 33/2020 that was issued over the weekend. I am very sorry for the anxiety and confusion that this order has sparked. This timing was not meant to hide information. Ironically, it was meant to be transparent. The intent was to ensure school authorities knew about the order, which codifies the guidance that has been online for weeks before the order came into effect today. I understand the concerns, especially as we move forward quickly and the need to ensure that Albertans have accurate information. I have committed going forward to a goal of only posting new orders Monday through Thursday, and whenever a new order is posted, I will share this information online via social media. My team and I continue to work closely with school authorities to provide accurate information and evidence to support the back-to-school experience for parents, teachers, students, and administrators. I must be clear that the order that was issued this weekend does not change our policy or my advice. Reports that indicate otherwise are not accurate. No policy has changed since mandatory masking was announced on August 4th. As a part of a number of new school safety measures to combat COVID-19, mask use for grade 4 to 12 students and all school staff is now mandatory. This applies to staff and teachers in all settings outside seated classroom instruction, where physical distancing of 2 meters cannot be maintained. Students will be required to wear masks in all shared and common areas, including hallways and on school buses. I also want to clarify the order as it relates to physical distancing between students inside the classroom. Physical distancing of 2 meter spacing whenever possible is a useful public health measure to help prevent the spread of disease. Increasing the space between persons decreases the risk of transmission. In schools, with respect to implementing the masking policy, we recognize that there could be impacts on communication and learning, and so in our policy announced in early August and in our school guidance online, we have always stated that masking is not required when the following is met. Specifically, where 2 meters is not possible between desks, the greatest possible spacing is in place, and if 2 meters cannot be arranged between desks or tables, students should be arranged so they are not facing each other. For example, they should be arranged in rows rather than in small groups of 4 or a semicircle. That way, if a student coughs or sneezes, they are not likely to cough or sneeze directly on the face of another student. Non-medical masks are not required while students are seated in the classroom during instruction if following the physical distancing guidance that I have just articulated. This has been part of our school guidance for several weeks. If close contact between students and teachers or staff is occurring as a result of non-seated classroom activity, in this case, non-medical masks should be used for the duration of the activity. The intention is to allow students a break from mask wearing in the classroom when they are seated and not facing each other, and desks are spaced as widely apart as possible. This is not new. I would also like to clarify information on in-school cohorts. The intention of in-school cohorts in our guidance is to minimize the number of people who would be exposed should an infectious case be identified at a school. In-school cohorts should be limited to those who are in a class together and should be kept small, limiting the cohort to just that one class. Teachers are only part of their students' cohort if it is not possible for them to keep distanced from their students. Teachers are not cohorted with each other, and in fact, the risk of adult-to-adult transmission between staff and in shared staff areas may be higher than student-to-staff transmission, particularly in lower grades with younger children. Teachers and staff need to stay attentive to these precautions in these shared areas and not let their guard down simply because they are away from students. The guidance also requires all teachers and staff to wear non-medical masks where physical distancing is not possible with each other. The successful reopening of schools depends on the choices each of us makes every day that collectively keep our community transmission low. It depends on the planning that parents need to do to keep children home if they are even mildly sick. It depends on our testing and notification system completing and refining the work that is currently underway to speed up turnaround times and rapidly complete contact tracing. It depends on school administration doing advanced planning on responses to exposures in their school. And it depends on students, teachers, and school staff doing their best to adjust to the new normal and helping each other to make the necessary changes. One of the great things about our school system in Alberta is that students come from a diversity of backgrounds, coming together to learn and develop. That means there will be a diversity of experiences and perspectives around COVID-19, and school can be a place for safe and respectful dialogue about how to navigate our path forward together. Another area of health that is important to consider as school begins is our mental health. COVID has exacerbated or triggered anxiety for many people, and re-entering school is a time of significant change for all those involved. It is a change from what daily life has been like for the past several months, but also a change from what we are used to in early September. Change and uncertainty naturally bring on anxiety, and I encourage anyone who needs extra support in this time of transition to reach out to formal or informal supports. Formal supports are available 24/7 by calling or texting the Kids Help Phone at 1-800-668-6868 or the Mental Health Helpline at 1-877-303-2642. Both of these numbers can be found online. You can also go online to the Alberta Health Services website, Help in Tough Times, which offers a wide array of resources and information on how to get help and how to offer help to others. If you have a family member or friend who you think might be suffering from anxiety, depression, or any other burden, reach out to them proactively to let them know you're thinking about them. These are tough times for many of us, and we need each other to get through. There will be a lot of change for many families in the next few weeks, and I ask us all to be kind to each other. Let's do our best to be patient with each other as we learn to adjust to new routines, new expectations, and new challenges. We will get through this next challenge, as we have the ones before, by working together, relying on evidence, and adjusting our approach when needed based on new information. Thank you, and I'm happy to take questions.
There are a lot of questions in the queue today, so everyone please keep to one question per turn and indicate who your question is for. We'll go to the phones now. Operator, can you put through the first question?
First is Jeff Slack with 660 News. Go ahead, Jeff.
Hi, Dr. Hinshaw. This is just on Order 33. Why do this now, just days before school? Why not just leave the physical distancing rule in place, at least for the first 2 weeks of school?
It's interesting how this is being interpreted as the guidance that has been in place for weeks and the policy direction that was set at the beginning of August is exactly the same as Order 33. Order 33 is a new tool to assist with the clarification of the requirements of the masking order, and we had heard that there was some confusion about the fact that the masking guidance in our school guidance documents articulated that masking was required whenever 2 meters of distancing could not be maintained. And there were questions about what does that mean in a particular school? Does it mean that students, if they are 2 meters, would take the mask off, but then maybe they walk closer to each other, put their mask on? How are schools supposed to enforce that? And so, again, somewhat ironically, the order was actually meant to clarify the guidance that was already out in the public space and the policy that was communicated about a month ago, which was to say that masking is required in all public spaces of a school, indoor spaces, and that the only way that a school can remove themselves from that requirement is if they provide a written plan that is approved by the Chief Medical Officer of Health that ensures that at all times that in indoor spaces and on buses that 2 meters of distance will be maintained. So the order actually was meant to provide that clarity that the physical distancing requirements are in place. However, as was stated when we introduced the masking policy a month ago and has been in our guidance documents online for several weeks, the requirements for masking within a classroom while students are seated, that requirement is eased as long as desks are placed as far apart as possible, students are seated and not doing active activity, and students are not facing each other. And so those requirements have been in our guidance for weeks and actually was a part of the articulation of our masking policy when that was first announced. So the order is not new. It doesn't provide any change to our policy. It was, again, requested as a tool to help clarify. And again, I am very sorry that, unfortunately, the opposite has happened and that this tool, which was meant to clarify, has caused more confusion. That was not the intention.
Operator, next question, please.
Next is Audrey Nouveau with Radio Canada. Go ahead, Audrey.
Hi, Dr. Hinshaw. My question is about the vaccines that the Government of Canada has secured with different pharmaceutical companies, about 200 million doses of vaccines from 4 different companies. I want to know if Alberta has any deal with the Government of Canada to obtain some of these vaccines or is in talks with the government concerning this.
In Canada, we work collaboratively on vaccine procurement, and so Alberta is a part of a national group that looks at vaccine procurement and all of the options that are out there. So we have members of our team who are working, again, with other provinces and territories and with the federal government to put in our requests for the number of doses. We're part of that planning on how vaccine would be prioritized. And so, again, that is a national collaborative process that Alberta is a part of.
Operator, next question, please.
Next is Sean Fernet with CTV. Go ahead, Sean.
Hello, Dr. Hinshaw. I wonder if you could expand on the church outbreak that you just talked about in Calgary. Do you know how this originated, how it spread? Was that church not following provincial guidelines in regards to masks and crowd size and distancing and that sort of thing? And how concerning is this for people in and around that church in Calgary?
We don't know the details yet, as this outbreak has just been reported to us, so it's too early to be able to say exactly how the virus may have spread. We know from a few of the outbreaks that we've seen in the last several weeks that sometimes it's possible, again, for the wrong person to be in the wrong place at the wrong time. And unfortunately, spread can happen when you have that confluence of an individual who is infectious, who may not know that they are, and perhaps, again, there's either a lapse or, again, we're looking very closely at the last few outbreaks to understand, does our guidance need to be updated? We don't have that information yet, but, again, that's going to be a part of this investigation to understand whether or not we do need to update the guidance and how we can best provide that structure for safety in these kinds of gatherings. With respect to the question of risk in that particular community, again, I would say that this isn't the only outbreak we're dealing with, and that the request that I made for the children who may have attended that church in the last 2 weeks to stay home from school until we can have this public health investigation completed is just a precaution. But I would really ask that this particular community not be stigmatized, but rather be supported. And again, if the guidance is followed, then that risk can be mitigated. And so this is a matter of providing the individuals in that community with the information that they need to be able to mitigate and minimize the spread, and for others around them to be able to support them in being able to do that.
Next question, please, operator.
Next is Christine Birak with CBC. Go ahead, Christine.
Hi, Dr. Hinshaw. Thanks for taking my question. From your update today, it appears Alberta's case rate is now higher than most other provinces. I know you've been here before, but do you feel an official mask mandate could help in more cities in the province at this moment in time?
What we're seeing right now from the cases, again, I don't have all the details about the cases reported over the weekend, but the bulk of the cases that, and the trends that we're seeing are transmission that's happening in places that wouldn't necessarily be impacted by a municipal mask mandate. We're seeing the majority of our new cases in Edmonton and Calgary, which of course already have mask mandates. And I think what is underlined for me, again, in some of the trends that we're seeing is, and I hear this from many different sources, that people are tired of living with COVID. They're tired of living with restrictions. They want to get on with their life. That is completely understandable. Unfortunately, we don't have the option of ignoring COVID. And so I don't know that a mask mandate in other municipalities would solve our current problems. I think what we need to do is look at the trends once we've had a chance to look at the cases that were reported on the 3 days over the weekend and see what kinds of exposures are linked to those cases. That may help us understand better what, if anything, we need to change. Until that time, again, each one of us has the ability to make a difference, and the choices that each one of us makes every day about following the guidance, about not passing the virus on to someone else if we have been exposed, about ourselves avoiding exposure in all of the places that we are. Each one of us acting in that way all together will make a difference. And so, again, I don't know that a masking mandate at this time would be the solution to our current case numbers.
Operator, please put through the next question.
Sammy Hudez with the Calgary Herald. Go ahead, Sammy.
Hi, Dr. Hinshaw. Just going back to your order over the weekend surrounding classrooms, I understand you're saying this information is not new and it's consistent with your previous guidance, and the order was just meant to provide clarity. But last week, many school boards across the province had their registration deadlines for parents to decide whether to enroll their kids in online learning alternatives. So why did this order come over the weekend, just a few days before the first day of classes, instead of providing that clarity, as you mentioned, to families prior to that deadline?
Our intent originally had been to get the order completed earlier, and unfortunately, because there were a number of issues that needed to be worked out with respect to processes and legal tools and those kinds of things, unfortunately, it took longer than we had anticipated. It absolutely would have been ideal if this order had been completed and posted sooner. That was our original intention, and unfortunately, again, just based on the way that it worked out, it took longer than we had anticipated.
Next question, please, operator.
Next is James Keller, the Globe and Mail. Go ahead, James.
Hi there. Questions for Dr. Hinshaw. I wanted to ask about asymptomatic testing for teachers. How many positive cases among teachers and school staff have been identified in the past couple of weeks since your recommendation? And then what is the plan for testing going forward? We know that testing results become out of date very quickly. They're a snapshot in time. So will you be recommending or even requiring regular testing of teachers, staff, or even students throughout the school year?
We didn't request that people identify their profession, or we don't request that people identify their profession when they come in for asymptomatic testing. So we don't have a specific number of teachers who've been through that program. I know that over the weekend we were notified by Alberta Health Services of a small number of schools that had identified cases in either teachers or staff or exposures in those teachers or staff. And those cases, again, are being dealt with at that local level by the local school, Alberta Health Services, and the school board. And so in terms of how many of those were identified through asymptomatic testing versus symptomatic testing, we don't have those numbers right now. The question about ongoing testing and repeating the testing is something that we are currently looking at. And when we determine what would be the most useful with respect to ongoing testing, particularly looking at that asymptomatic, we will be sharing that information at this time. Again, we're focused on the processing of the samples that have currently come through. As you can see, we have had an increasing volume of samples over the past several days, and our priority right now is moving those through as quickly as possible, dealing with those who come back positive, ensuring that that contact investigation happens as quickly as possible. And within the next several weeks, I anticipate that we'll be saying more about what we're recommending going forward with respect to asymptomatic testing.
Next question, please, operator.
Next is Dylan Short with Post Media. Go ahead, Dylan.
Hi, Dr. Hinshaw. Going back to the order that you issued, from my understanding and from what you said today, even in classrooms where students aren't 2 meters apart, but they are distanced as far as they can, if they're sitting at their desk, they don't have to wear masks. I'm wondering why this decision was made, given that we've heard, in Calgary and Edmonton, we have to, but you've stated that people should be wearing masks if they're not 2 meters apart from other people.
It's a really good question, and it goes back again to the policy decision that was made at the beginning of the month that I think perhaps wasn't understood. We tried to communicate that, but it sounds like there was some confusion generated by this order, so this is a good opportunity to clarify. The decision was made based on looking at, in a school environment, with the other measures that are being put in place to control transmission in that environment. So with respect to regular symptom screening, with respect to the cohorting that's happening, surface cleaning, all of those measures are in place, whereas those are not in place, particularly things like cohorting and active symptom screening aren't necessarily in place in other public places. The other piece about this is that we know that having masking during school, during that class instruction time, can for some be a barrier to learning or a barrier to communication. And as we were looking at our masking policy, provincially, again, this is to span the entire province, we were trying to balance the benefits and harms of masking and figure out how we could best achieve the most appropriate COVID prevention, while at the same time not impeding some of the important functions of school. In some places, as you mentioned, school boards have chosen to go above and beyond our requirements. And as you know, in some places in the province, there are higher case rates. And so there may be appropriate measures taken in local areas that wouldn't be appropriate across the province. And again, we had to make the decision that was right for the entire province, which is why the policy was articulated the way that it was.
Operator, could we have the next question, please?
Next is Lisa Johnson with Post Media. Go ahead, Lisa.
Hi, I'd like to ask a question of the Deputy Minister. I'm wondering, this order came out this weekend, and a lot of Albertans are wondering, like Dylan said, why are there different public health orders in a Walmart or a Home Depot than there are in schools? And thank you, Dr. Hinshaw, for addressing that. But I guess it appears to a lot of people as though this was a move to align government policy with public health orders that are not in line with other public health orders. And is this a move to, avoid litigation for the government from teachers who might be entering a workplace that they don't feel is safe?
So I'd start off by saying, no, it's not the latter. It's like Dr. Hinshaw said, we needed to formalize the policy decisions and the reentry planning that had been done up to date, especially since the beginning of August. And the order, again, changes nothing in the application of that. And so it just clarifies the policy.
We have time for one more question. Could you put through the next question, please?
Final question is Julia Wong with Global News. Go ahead, Julia.
Hi, this question is for Dr. Hinshaw and perhaps the Deputy Minister. Some infectious disease specialists say with kids going back to school, teachers are the new canary in the coal mine. They say mobile testing units should be set up at schools to be proactive and so that teachers can have quick access to testing. Is this being explored for the upcoming school year? And if not, can you please explain why not?
There has been quite a bit of work done to make testing as easy as possible, and particularly looking at options for teachers. As you know, there was a contract that was issued between Alberta Health Services and Shoppers Drug Mart, as well as testing at all pharmacies across the province. It's critical, though, that if a teacher or a student is feeling sick, if they actually have symptoms, that they get tested through the Alberta Health Services process, as that process is where anyone who has symptoms can be managed appropriately. And testing for those who don't have symptoms can be done, again, through pharmacies, including but not limited to Shoppers Drug Mart. With respect to mobile teams or on-site testing, I think what we want to do is understand the needs of the educational system and where that might be appropriate, and whether or not that's an option. I mentioned that we are looking at what the recommendations could be going forward for testing, and so those are things that are currently being looked at. Again, I think it's important to remember that there are many places around the world that have reopened schools, and there have been different experiences. So one example to highlight is Scotland's choice when they went back to school to actually not require any physical distancing between students, both in lower grades and upper grades. And Scotland schools opened in August, on August 18th. And to date, again, it's just a few weeks, but so far there haven't been significant outbreaks noted. We do know there's cautionary tales, such as in Israel, where high school did have a significant outbreak shortly after reopening. So we're not, again, taking this lightly. But I think what we need to do is look at all of our options, use what tools we have available to us, and then adjust if needed as we have the experience with our reentry model. So that's what we're doing. And I don't know, Deputy, if you wanted to add anything to that.
That's it for today. Sorry we couldn't get to everyone's questions. Dr. Hinshaw will be providing the next update on Thursday.